Good afternoon, council members. My name is Dr. CJ Valasek. I am a researcher and policy advocate at CPI, Center on Policy Initiatives, here in San Diego. I'm here to speak in support of hospitality workers. Too often, policy discussions are made without workers ever having their voice heard. Their struggles go unnoticed. However, in our research and partnership with the UCSD Labor Center, we were able to spotlight a number of worker voices. Thankfully, we have a number of workers here to share their stories, but we were able to speak to 74 different hospitality workers to complete our surveys and do 9 in-depth interviews. So this research report, which is now on the UCSD Labor Center website, is titled Inhospitable, San Diego Tourism and the Struggle for Fair Pay. I'm going to speak a bit about those findings from those surveys and interviews. As you know, that hospitality workers are struggling to get by, but what does that look like? One worker told us, "I've worked more than 20 years in hotels, and still I can't afford a decent apartment. I live with my family," meaning their parents, and because otherwise I would be homeless. Another recalled coworkers sleeping outside after long shifts. They can't afford a lift home, he said. And I've had coworkers that spent the night on a bench out in the city until they woke up the next morning to come back to work. Think about that. In one of the wealthiest cities in the country, people serving visitors to America's finest city are sleeping in cars, staying on couches, or worse, because their jobs do not pay enough to keep them stably housed. Transportation adds another layer to hardship. Nearly half rely on public transit, often spending hours commuting each day. As one worker put it, "I can't afford to live near my job, so I drive from far away, pay for gas, pay for parking, and by the time I get my paycheck, it feels like I'm working just to come to work." Food insecurity was present as well. A worker described how shifts stretch without any meals. Another emphasized family sacrifice, saying, "I make sure my kids eat first, and sometimes I just go without. That's what it takes." Is that what you want to tell the workers? But workers also told us what would make a difference. About 70% said that a $25 minimum wage increase would finally let them cover rent, food, and health care. More than half said it would allow them to save or pay down debt, and 90% said it would improve their quality of life in a real and lasting way. This is not radical, it's not untested. There's lots of citations in our report, so I hope you will read those that show the benefits to the community, to workers and businesses if you increase the minimum wage, which I hope you will do for all workers, even higher. Thank you.